I've chosen the topic Crohn's disease. And I've chosen this topic today because I was diagnosed with Crohn's disease about 15 years ago. And Crohn's disease is a chronic inflammatory disease of the intestines and the digestive tract, and it especially affects the colon and the ileum. It can also be associated with ulcers and fistulas in this case are narrow passages that can lead to and from an abscess in the intestines. And it's also important to know that Crohn's disease is different from ulcerative colitis, which is another type of inflammatory bowel disease. Ulcerative colitis is limited to the colon, and Crohn's also affects the ileum as well. And Crohn's disease is not contagious, and it is not caused by something someone has eaten or done. And here you can see the colon, and which is also known as the large intestines, and the ileum, which is the third and final segment of the small intestines. And these are the areas that are targeted by Crohn's disease. And researchers they believe that Crohn's is an experience of an overactive immune response. And so as a result, the intestines become chronically raw and inflamed. And this continues, and it damages the intestines from the inflammation, and the digestive system now exhibits these symptoms: frequent and recurring diarrhea, rectal bleeding, weight loss, fever, abdominal pain and cramping, fatigue, and also the lack of appetite. And these symptoms can be mild, which can be just diarrhea or mild cramping. It can also be severe, which could also mean an obstruction or an abscess in the intestines. And Crohn's disease is also very unpredictable because at 1 minute you can be mild and the symptoms can change very quickly. And also symptoms can occur outside of the GI tract, affecting the eyes, the skin, and joints. And for myself, symptoms start to appear on my skin because I developed psoriasis as a result. And someone may also go through periods of remission where they have no symptoms at all or very few symptoms. And the sad part is that with Crohn's, your symptoms can come back suddenly without warning. And so a question is, who is at risk? With Crohn's, it affects both men and women equally. And the average age is between 15 and 35 for the onset of symptoms. And it affects all races. And there are even cases of children as young as 2 years old with diagnosis of Crohn's. And the question is, what causes Crohn's? And actually there is no cause, a known cause, but Crohn's is known to cause chronic and ongoing inflammatory bowel disease, which may stem from one of the following. So if hereditary, it means that someone may inherit the genes that makes them susceptible to Crohn's disease. As far as the immune system, it can be triggered, and it affects the gastrointestinal tract, causing inflammation that contributes to the systems because, like autoimmune diseases, the immune system turns on itself and attacks its tissues in the GI tract. And environmental factors can be bacteria, a virus, or some unidentifiable factors like antigens. They get into the environment and can trigger an abnormal immune response in the body that may stimulate the body's defense mechanism, which is inflammation. And in a Crohn's patient, it's in the GI tract and it's uncontrollable. And then once a patient is diagnosed with Crohn's disease, there are a few ways to treat the disease because there's no cure at this time for it. So they manage the symptoms of Crohn's. There are therapeutic agents. For example, there's Remicade and Humira, which some may have seen the commercials on television towards ulcerative colitis, but also works for Crohn's. And these drugs are called TNF inhibitors or biologics, and they work by neutralizing the immune system protein known as a tumor necrosis factor, or TNF. And I take Remicade, which is, I'm given an infusion, which is a drip for about 3 hours every 8 weeks. And there are also corticosteroids, which doctors prescribe for short-term symptoms, and they're usually given for mild to moderate symptoms. And Euceris is an example of that type of medication. And there's also nutritional therapy, where the doctor and the health team may create a diet plan for a patient that may be low in fiber because you want to decrease the frequency of elimination, and a low fiber diet can do that. And then there's surgery, where about 60 to 75% of Crohn's patients at some point in time may have to have surgery to repair or potential complications such as clearing an intestinal blockage or repairing damage to the intestines, like a perforation or an abscess, which is a pus-filled area caused by infection. And what happens if someone goes untreated with the symptoms or diagnosis of Crohn's? Someone may experience a bowel obstruction, malnutrition, ulcers, and even colon cancer, in which all of these could lead to death. And there's also cases of arthritis and osteoporosis if one goes untreated. And living with Crohn's, of course, exercise is important. It's an essential part to everyone's lives. And with Crohn's, exercising will help many factors, such as boosting your overall health. It will also control your weight, which helps with everyone, relieve stress, strengthen the immune system, which we definitely need, improve the mood, and also reduce depression and anxiety. And along with this, it is very important to consider your mental health, because it is important to take care of oneself, like I said, not only physically, but both mentally and emotionally, because emotional stress can trigger some of the symptoms that come on, an onset of the symptoms. And so some areas, people join support groups where you can ask questions, find out other answers, and discuss things, because it's good to know that you're not alone in this journey. In nutrition is important because poor absorption of nutrients, for example, B12 in the intestines, and the loss of appetite of a Crohn's patient may deprive the body of essential nutrients. Therefore, one must be mindful of eating healthy, because malnutrition may occur. And with that being said, some people with Crohn's may benefit from limiting dairy products, trying low-fat foods, experimenting with fiber to find that perfect spot of what works best for them, avoiding gassy foods, eating smaller meals, and lastly, drinking plenty of water. And so in conclusion, all of these symptoms could mimic like a stomach flu or food poisoning. So that's why it's very important to go to the doctor if these symptoms occur often, because you do not want malnutrition or any of the other mishaps that we discussed earlier. And it's important also to be honest with your doctor and not be embarrassed by this conversation, because we know that it can happen to anyone. We know that it can be deadly, but we also know that Crohn's patients can live a healthy lifestyle if they exercise and eat healthy. Thank you.